welcome to you all today. I am Dr. Radhika Patil. I am Head of Physiotherapy and Rehabilitation at Jehangir Hospital in Pune. I am delighted to introduce today's special session on the occasion of World Health Day. A very, very happy World Health Day to all of our viewers today. This year's theme is Healthy Beginnings, Hopeful Futures, focusing on maternal and newborn health. This theme highlights the importance of quality care for mothers as well as their newborns right from the beginning. I'm joined here today by an exceptional panel of consultants who bring a wealth of experience and insights to this important discussion. I'm very happy to welcome Dr. Anshu Sethi. She is a consultant pediatrician and neonatologist at Jehangir Hospital. She specializes in treating a wide variety of conditions that affect newborns, infants, and children. I also have with me today Dr. Ritu Petkar, consultant gynecologist and obstetrician. She has over 17 years of experience and she is known for her expertise in natural birth and holistic maternity care. Let me begin right away by asking Dr. Petkar, why is maternal health so important for a baby's future well-being?
Of course, it is very, very important because as socially we would know that mother is the best caretaker of the baby, one who can shape up the child's nature, education also, and in every other aspect. So maternal health, if she is healthy, then she would be able to take care of her baby in a much better way, in a much confident way, and in a much secured way. So hence I feel the maternal health overall is important for the child's well-being. Also the child would learn from the mother as to what values and how to take care of one's own health. So in all those aspects, the maternal health is important.
Yes, doctor. Indeed, I've heard that even your grandmother's health will affect what you are today.
Absolutely.
Apparently. Yeah. So, what lifestyle changes should a woman make when planning for pregnancy?
Well, when a woman is planning for pregnancy, of course, looking at today's generations and scenarios, the first thing that I would say is lifestyle modification is something that is very much in the woman's hand. She should look into dietary changes where eating junk needs to be avoided. Anything that will lead to weight gain, increase sugars in the body. So diet modifications need to be done. Something that is very dark and deep colored will have more of antioxidants, so that can be included in her diet, like say cranberries, plums, spinach, beetroot, which is very easily available. Exercise is of course an integral part. Yoga, because certain postures are more inclined towards increasing blood supply to the reproductive organs, so that is important. Breathing exercises also I definitely stress upon because importantly most of the women are working these days and stress is something that they battle on a day-to-day basis. So meditation and pranayam is very, very important, which aligns their body. It aligns the HPO axis, the hypothalamo-pituitary-ovarian axis. So that's important. Another note that I want to add here is de-addiction. So as social drinking, smoking, even substance abuse, we see a lot these days. So at least a 3 months break into all these things by both the partners is extremely important. We were talking about lifestyle modification is what you asked. Yeah. Okay. Yeah.
So I'd like to add a little bit to that because we do get a lot of mothers prenatally as well in our clinic at the physio department, and yes, these are exactly the things that we keep reiterating to them, that everything that you are used to doing physically before your pregnancy, you're okay to go during pregnancy as well. So it's a common myth that because you are pregnant you don't have to be physically active, you should not exercise, but it is in fact to everybody's, mother's as well as child's benefit if the mother is physically active as much as possible and doing all the things that she used to be doing before. Now, unless a doctor has specifically said for some reason that certain exercises need to be avoided, we prefer that nothing new is begun in pregnancy, if I'm not wrong.
Yeah.
And everything normal should continue.
Yes, because it's a physiological process. Pregnancy is not an illness or disease or sickness. It's a normal physiological process. One needs to understand that. And there is, of course, a scare and fear in women. So preconceptionally, I think a counseling session with a doctor is extremely important, that needs to be stressed upon, so that all these questions get addressed and they are out of the fear, because everyone will have their own ideations and beliefs through which, or some Google knowledge or through internet or hearsay from their friends, which they don't know then what is truth and what they should believe in. So I feel a preconceptional counseling is extremely important for a couple who is willing to conceive. So all these things can get addressed there.
Yes, absolutely. Dr. Anshu, can I ask you, how can parents ensure that their newborn gets the best start in life? This is probably an extension to what we are talking about.
Yes. As Madam already indicated, if the mother is healthy, the baby is anyway born healthy. So the best start in life would be that the baby gets the breast milk right from start. That is the most important. As we say, the first half an hour of life is the most important, where we can initiate breastfeeding. So once we initiate breastfeeding in the golden half an hour, that will ensure a best start for the baby. Breast milk not only provides colostrum, it provides the best nutrition, it provides immunity to the baby, and early start of breastfeed will provide a longer lactation and a good output to the baby. So the second thing most important to the baby for the best start would be close to the mother, bonding with the mother, no prelactal feeds, no giving honey or any other water to the baby, ensuring that the mother and baby are rooming in, bedding in along with the mother. And most important, vaccination on time. That will ensure that the baby is healthy. We are preventing vaccine-preventable diseases. Another important thing for the newborn, the best start would be that the baby is, healthy with the mother, and the mother ensures warmth. There is no hypothermia to the baby.
So, right. Dr. Ritu, would you like to comment on kangaroo care, since we are on this topic
yes,
right now?
Definitely. So kangaroo technique is wherein we know how the baby and the mother are in a kangaroo method. So wherein the baby is sort of very close to the mother, and there are benefits immediately after the baby is born. We give the mother, the baby is given to the mother immediately, and the mother sort of holds, and the skin to skin touch is given. So the benefits of this is for both the mother as well as the newborn baby. For the baby, it gives the immediate sense of security because there is an emotional connect, is what I believe in. And there is a temperature, the baby's warmth is maintained. It's also seen surprisingly that the respiration is very good when you give that baby to the mother immediately. Unless and until there is some problem wherein we feel that the baby needs immediate attention, like the cry is weak or some other problems, then of course it's a different approach. But in a regular thing where everything is normal, it definitely enhances the baby's well-being in the immediate effect as well. Like the heart rate is better, the warmth is better, temperature control is better, emotionally it is better. Also we see that sometimes the baby crawls and searches for the breast and immediately starts with the sucking reflex also. For the mother, it is important because the mother also feels that whatever effort she has put in, the baby is now with her. So her anxiety also goes down. So for her also, it's a better way that the baby is given to her in a kangaroo method.
Thank you for this.
I'd just like to add also, in kangaroo mother care are preterms and low birth weight babies. Once they are stabilized, the kangaroo mother care not only helps to remove their fear of the mothers, but it also helps to improve oxygenation, prevents apnea, improves their weight gain, shortens the hospital stay. and it prevents morbidity, mortality. You see, even the developmental quotient of a baby improves with kangaroo mother care.
And something as simple as that.
As simple as that, yeah. And I'm proud to say that in our hospital, we have a KMC nurturing environment. In our NICU, even in our postnatal wards, all our nurses encourage mothers to give kangaroo mother care.
That's wonderful. Ma'am, I'll still ask you, you talked about breastfeeding, right? So we, as mothers, we want to breastfeed, but no one had, at least for me, no one told me how hard it's going to be. So if there are difficulties that a mother faces, then what should be done about that?
That's a very pertinent question, especially nowadays. So as we discussed earlier, antenatal counseling also goes a long way in promoting breastfeeding. Seeing the nipples in the antenatal, telling the mother that immediately as soon as the baby is born, the baby will be put to the mother's abdomen with the breast crawl. Immediately we can start breastfeeding. Now, if the mother faces difficulties, first the family support is very important. We have lactational counselors which will help to detect any engorged breasts or breast nipple problems. But family support, initiation of the mother, and also of course checking that the baby doesn't have any problems. Like, you know, any cleft palate or anything in which the baby is not able to take. But I think most important, if the mother has difficulties, most important is just the mother and child bonding, which can be settled at a maternal level with our help, with the nurses' help, like a team effort, and also with the lactation counselor. Initiation of breastfeeding early, promoting breastfeeding from the antenatal visits, ensuring that the family support is there to the mother, will go a long way in promoting breastfeeding.
And then whom should she go to in case there are difficulties later?
I think the best would be her obstetrician along with the lactation counselor.
Right.
Like a team effort would go a long way.
Right. Yeah. Dr. Petkar, how can we encourage the fathers to also take part in all of this? Because we are constantly talking about mother, child, but I'm sure fathers have a big role to play.
Of course, it is very important. I'm happy you brought this up in this live. So fathers actually have a very vital role, because it's not the woman who has given birth, but as a couple they have now extended as a family. So I feel that the couple has given birth. The father also has a significant role in this whole process. During the labor, during the antenatal phase, encouraging the woman, taking care of her emotional things, being a part of her antenatal visits. So it's not just the woman who's supposed to go for the visits. The husband has to take accountability, take out time from their schedules, taking care of her diet. So these things are important during the pregnancy. During the labor as well, the husband has a very vital role to play. So I feel that like very simple things, giving back massages, or being there with her, holding her hand, giving her strength, giving her courage when the labor is on. So with all these, the kind of confidence that the woman gains is tremendous, and I feel it definitely relieves her of fear and anxiety. Post-delivery also, assisting in breastfeeding, taking care of the baby. So all these things will improve the bonding of the couple, bonding of the baby with the father. So traditionally, the men in India have been educated such that they have to be little away when the woman has gotten into birthing and when the child is born. But I feel we need to revisit this thought and include men in a much larger way into taking up the responsibility of the baby and the care.
Yes, and I'm sure that will make them also feel included in what's happening.
Absolutely.
Ma'am has something to say. Yes.
And we can encourage the new dads also to give kangaroo care. Because
yes,
even
that's right.
they are included in the kangaroo care, even in our NICUs, once the baby is stable. The dads can also come and give kangaroo care, which makes them feel they are part of the process. Yes.
That's right. And ma'am, talking about the NICU, if there are preterm babies, then what challenges do they face in the first year of their life?
Now, preterm babies face a lot of challenges. When they are born early, there are short-term problems as well as long-term problems. Short-term, immediately they'll have to go to the nursery, so they may face a respiratory issues like breathing issues, which is called respiratory distress syndromes. They may have metabolic problems like hypothermia, hypoglycemia, apnea, bradycardia. They may suffer from feeding difficulties, GI problems like necrotizing enterocolitis. But these all gradually can be overcome with good expertise, patient care, and early referral to tertiary care centers. The long-term problems faced by these babies are frequent infections, failure to thrive. They may have chronic diseases like chronic lung disease. Some of them may have intraventricular hemorrhage in the early days of life, so they suffer from neurocognitive problems or learning disabilities. So preterm babies and low birth weight babies, though they do well, but they require close follow-up and close monitoring. So they are encouraged to have a close follow-up with the doctor in terms of dietary advice, in terms of nutritional follow-up, close follow-up for vaccinations, and early detection of any problems whenever needed.
Right. Ma'am, would you like to also elaborate on vaccinations then for children? Why are they important? And because there's a recent trend of people saying that we don't want XYZ vaccine for our child.
Right.
But I think we've achieved a lot with vaccinations.
Yes. Good you brought up this point. Vaccinations are really important in the first year of life. They prevent the preventable diseases, vaccine preventable diseases, and these diseases are life-threatening. Since the immunity of a newborn is very low, they are very susceptible to these diseases. So these vaccines have very less side effects and they give extreme protection. They are also protecting the environment because they have herd immunity. Like when we give polio drops or injectable polio, it gives herd immunity. Then it gives eradication from the disease. Plus DPT vaccines give a lifelong protection, measles vaccines, varicella vaccines, these all are extremely important in the first year because they give immunity for lifelong and they are vaccine preventable diseases, especially for the newborns. And they also give herd immunity.
I would like to add here that yes, even I have come across a lot of couples who are now not willing to vaccinate their kids. The recommendation medically is definitely that since these are life-threatening diseases, that if they come, they will live through a severe disability or like life-threatening. You understand what that means. So that's why it's always recommended. But however, if the couple is very much adamant that no, at any cost we do not want to go ahead with vaccinations, with due consent I have done that as well, because I have had such patients who said that no, we don't want to give, and I respect that, and then we just tell them what could be the consequences, and then accordingly they sign the consent, and then we proceed with no vaccination, of course with the pediatrician also included in this consent. Yeah.
Right. And again, I'd like to ask you for very first time parents who feel very overwhelmed with all that is happening. There are vaccines and there are nutrition of the baby and the mother and what to do, what not to do, all your relatives telling you what to do, what not to do. So what advice do you have to first time parents?
So the most important thing is not to panic and not become overtly cautious that something will go wrong, oh the baby is crying, what should I do, what should I not do, like whether the woman can put something in her mouth or not, whether she can eat this. So we need to understand that this is a physiological process and the overt care need not be given. We can just leave the woman with the baby and automatically things start aligning. Support is the most important thing that can come from the husband. And the woman also did not be in fear. What usually we see is breastfeeding is the most important thing that needs to be taken care of post-delivery, be it C-section or a normal delivery. So in that, the mothers get into a panic mode that doodh nahi aa raha hai, like milk is not coming. Relatives get into panic, milk nahi aa raha hai, usko to kam hi aa raha hai, baby ro raha hai, peet nahi bhar raha hai. So this is the only thing that is continuously bombarded onto the woman. Because of that, she also starts thinking, oh, I'm less, I'm not good, I'm not able to provide. I feel that immediately after the delivery, what the couple can do is they can just get to themselves, because that's the most closest family. So that's why education to the husband, education to the woman is extremely important. My advice is, do not panic. First of all, do not be overtly conscious of every single thing happening. Baby, so we can actually speak, laugh, do everything, because our reflexes have developed like that, but baby can only cry. So don't get into panic based on that, is what my first advice would be immediately post delivery, because that's what I see. And mothers should never think that I'm not getting milk, I'm not good enough, whether I'll be able to take care of the baby, whether I'll be able to breastfeed, whether I'll be able to hold. These are natural instincts, you're born with these abilities, so don't doubt those.
Okay, so yes, that's very good to know. Also, in the same vein, let me ask both of you, what are the most common myths and misconceptions that you might have encountered regarding pregnancy, newborn care, and so on?
The most common myth in newborn care is they feel that you have to give the honey to the baby. If you don't give honey, there will be a problem. Give water in summers. This is absolutely not advisable. Then they feel that the cord, you have to apply oil on the cord or put oil in the nose and ears of the baby. Do massage very forcibly. All these myths have to be busted. Baby just requires gentle care. And 100% all mothers, as she said, produce milk. So there's another myth that the baby will not be fed properly. Babies crying because of less milk supply. Babies cry for various reasons. They pass stool, they cry. Their communication is crying. So they maybe just want to be held. They maybe want to be comforted. So if the baby is passing urine 3 to 4 times a day and baby's weight is gaining, baby is getting enough milk. So these are the myths generally which we have to tell the mothers. And another, I think ma'am will solve that, food in pregnancy and diet and lactation. There are several myths around that. And the poor mother is forced in a room without any food which she likes, and she's not supposed to go out, wear a scarf. So all that, I think mother can be natural and live a natural lifestyle.
Yeah, so about the food post delivery, I think that's a very important point that you brought up. Thank you. It's been so that they, at least in Maharashtra, the area that we are in, we see that they're given very few, 1 or 2 vegetables, and mostly it is dal with chapati or dal with some bhakri. The scientific reason to this has not been made available. I have done my own research also into it, but I have not come across any agreeable answers to why it would be. On the contrary, this is the time when the woman requires her vitamins, proteins, hydration to the best that we can give her. Because when she is breastfeeding, the lactation has all kind of calcium, minerals, everything is drawn from her body. So much of protein going in that. Plus the reproductive area is also getting healed, it is getting rejuvenated. So in that process, protein forms a very, very important part of the diet. So I feel we need to change this mindset and give her a good diet. Also in this regards, many a times there's a misconception that eating this will give gas to the baby. If she eats banana, for example, the baby will start sneezing. If she takes coconut water, then the baby will have cold. So these are like some myths which have no scientific background. And food, so milk composition, what I would want to tell the audience here is that milk composition of humans is same universally. So that's why we have breast banks also, which are milk banks also, which are available. And it can't change based on what she is eating. Yes, some medicines can go in the breast milk, but if she has chana today, we are not going to find some element of chana in her breast milk. So that's why a good high protein diet is extremely important, filled with minerals and fibers, because she should not have constipation.
Yes, so in that same vein, are there any essential postnatal care tips for new mothers? Anything that you, breast care for example, because there's a lot of pain sometimes, and also if there are sutures, then how to take care of those?
So we will look into this as normal delivery and C-section, because that's how women deliver. So in normal delivery, the episiotomy care is extremely important. Some women may deliver without an episiotomy also, but still perineal care is important. In that seats bath, wherein we ask them to sit in a tub which has some antiseptics and warm water, so that sort of clears that area, keep it hygienic. And even with episiotomy stitches, episiotomy is a small cut that is given on the perineum when the obstetrician feels this. I'm telling the audience, of those the doctors know it. It's a small cut which is given on the perineum if the doctor feels that the space is inadequate for the baby to come out, or there's a possibility of injury either to the anus or to the urethra. So if they feel the space is inadequate, then they give a small cuts. That's what we are talking about when we are saying episiotomy. So therein the care is applying some ointments, taking regular seeds bath. In the hospital, the physiotherapy department also has a special care that probably you can talk about. And with that, the episiotomy care is taken. For cesarean, the movement is slightly delayed, means in the 8 hours, 12 hours, slowly in a day's time, the woman adapts to moving herself. So, however, early ambulation is what we advocate. Passing urine early is what we advocate here as well. So now with more medical advances, the things have become easier, more comfort is possible, early recovery is possible. So not much of a difference remains these days between C-section and normal delivery in that front. About the food also, in normal delivery, as I said, all food is immediately advisable, but in C-section it's gradual, like she has to be started on liquids, then soft diet, then slowly it moves to a comfortable diet by second and third day. That's about food. And breastfeeding, I think we already discussed, that is extremely important. Regarding breastfeeding, the woman after the third, fourth day, when the milk actually starts coming. So initially it's the colostrum that comes, and that's also very important to be fed. When we were talking about myths, I think we can tell the audience about this also, that colostrum is not witch's milk, or it's not bad to give to the baby. That's a very common myth that is existing. In fact, that's very high on protein, very high on immunoglobulins, and when fed to the baby, it rises the immunity of the baby in a much better way. So now it's definitely advised, and many aware parents know now that colostrum is good. So that needs to be fed post-delivery. Day 3 is the time when the kind of white milk actually starts flowing. So then, if the woman feels that the breasts are getting engorged, she should empty them regularly. That's a very, very important thing that women should be aware of. If she gets fever, if she feels excessive pain in the breast, then she should report to the doctor. If postnatally, we are talking about 3rd, 4th, 5th day now, if there is excessive bleeding, whether it is normal delivery or C-section, or if there is pain over the episiotomy side or the perineum or in the stitches in the abdomen, then the mother should report to the doctor immediately. So I think these are medically very important things that need to be taken care of.
Right, and as we all know, any stitches or any injury to the area, the perineum, as well as if there has been a C-section, the stitches will or the wound will heal within about 4 to 6 weeks. And after that, we always advise all our mothers to start their regular physical activity, go about doing their regular chores at home, and then start a gentle exercise regimen which should be slow and progressive in nature, so that they can get back their previous levels of fitness. So this not only helps them but also their baby, because it protects their backs, their bones, and helps the mothers to find more energy to go about their demanding jobs as mothers.
I have one thing to add here. So it takes around 6 weeks time for the whole body to come back to a pre-pregnant stage. So the uterus to come back to its normal pre-pregnant state, the vagina to come back to its pre-pregnancy state. So this whole bodily changes that have occurred during the 9th month, it takes around 6 weeks time to come back to normal. So it is very important that the woman is extremely careful during that time, especially like lifting heavy weights needs to be avoided during that time because the uterus is very heavy. It will unnecessarily increase in intra-abdominal pressure will lead to the uterus sometimes coming down. In that sense also, high protein diet is extremely important. A little later, vagina rejuvenating exercises are also very, very important that the woman should start with.
Yes, absolutely. Then coming to the second pregnancy after all this, then let's talk about why family planning is important and what are the safest contraceptive options after a delivery.
Spacing is important because spacing, when we are saying spacing, we means the gap between two kids. So in that sense, the woman needs time to recover, extremely important. Nutritionally, the body has drained a lot. The whole baby has got formed from whatever the mother had taken inside of her, whatever was there within. So that's why it takes time to recover completely. Plus, the first child also needs attention. When the mother immediately falls pregnant, like in a year's time or so, then she has to manage the baby who's very young, manage herself, and the third is the baby who's in the womb. So then it becomes an added stress and the justice is not done to the child who's already born and the child who's in the womb as well. So I feel spacing plays a very, very important role and a couple should definitely look into it. Ideal contraceptive methods immediately would be barrier methods. Now, many couples feel that how can immediately pregnancy happen? But I want to emphasize this to the audience that after delivery, there are many cases where the periods never came and the woman thought that because she is breastfeeding, she will get the periods, and after 6, 7, 8 months, she realized that she is already 3 months pregnant, she is already 4 months pregnant. So that's why it's important that whenever the sexual activity happens, contraceptions are used. Initially, it could be barrier methods of contraception. Copper T is also a very good method of spacing wherein once left inside, the chances of success means the chances of failure of a copper T, that means happening of a pregnancy with copper T in situ is very less, so that's advisable. Hormonal methods are not advisable post-delivery because they interfere with breastfeeding, especially estrogen progesterone combined pills. In some women, progesterone only pills can be given, but most of the people do not want to resort to hormones. So in that, the mechanical way like a condom or a copper T are the best way to go ahead.
Yes, thank you. Dr. Sethi, I'd like to ask you about the first year of a baby's life. And when the baby is no longer a toddler and we are getting beyond things like a solid feeding and so what are the things that will ensure the baby's health or the toddler's health at this first most important year of its life?
Yeah, that's a very good question. Weaning foods on time, that is very important because that will give the baby a balanced diet. So at 6 months, we advise complementary feeding. Baby should be introduced to complementary feeding at the right time. Breastfeeding can continue till 1 year, but giving the baby calories with carbs, proteins, well-balanced diet with fruits and vegetables, that will go a long way in boosting the immunity. Secondary would be, encouraging the child to be off screen, which is now a major problem, starting even from 7 to 8 months.
Yes,
Working mothers put the child on, with the video or mobile, which is very detrimental in the long run. We have seen cases of autism even as early as 2 years. So we encourage the toddler to play, to be, spoken to, continuously be engaged in games and make the house child-proof so that there are no accidents. Keep the medicines and any medicines or any dangerous drugs away from the baby's side. Ensure that the child doesn't suffer from any accidents at home. And most important, of course, for the child is to be also having outdoor play, adequate sleep, balanced diet, giving vaccines on time. and consulting the doctor whenever there's a problem early.
Yes, wonderful. I think on that note, I think we've covered a lot of topics here today within a span of half an hour. And I would like to encourage our audience to please get in touch with our professionals. As you can see, they have scientific evidence-backed methods in the way they treat us as patients, and please feel free to make appointments and visit them whenever you feel the need to do so, whether you are a mother, a lady who has just delivered, and whether it's for your little child or baby. Thank you very much, and I wish you all once again a very happy World Health Day.
Thank you.